The good news is that there are options for everyone. I definitely advocate for breastfeeding if able. And formula feeding is definitely okay. The advantages of breastfeeding are that there are advantages for both mom and for the baby. It increases maternal fetal bonding. It is readily available. It has strong antibodies that are important for the baby in terms of digestion, reducing respiratory infections. It has advantages for mom in that it reduces the chances for breast cancer and helps reduce the size of the uterus shortly after birth. I think that on both ends, it's definitely a win-win. The one thing that we do recommend when it comes to exclusive breastfeeding is that the mom supplement or give the baby additional vitamin D drops during the exclusive breastfeeding period because, in general, we don't make enough vitamin D ourselves to pass on to the baby. Vitamin D is an important, hormone to promote bone health and for immune system. Formula feeding is also a wonderful option for nutrition for the baby. There are many commercial products on the market. Most hospitals will discharge parents and families on the formula that they are contracted with. For the most part, the differences are very minimal, although this is a commercial product. They do offer very slight differences. However, the base is the same in terms of calories per ounce, which is very similar to breastfeeding. It's about 20 calories per every ounce. The fatty acids that are in there are also try their best to mimic breastfeeding. So they are effective in obtaining nutrition for the baby. As far as sometimes parents will ask about different formulas, and it's a matter of how well the baby is doing on that formula. So I usually recommend keeping the formula that is working as for their primary source of nutrition. The other thing that parents ask about is breastfeeding and formula feeding together, which is definitely fine. Sometimes there are limitations in breastfeeding. There might be a maternal factor that inhibits the child from being fed, maternal infection, breast concerns, or if the child does not latch on, formula feeding is okay. And alternatively, mothers can express breast milk if they can to give the baby breast milk. And so with that being said, breastfeeding exclusively or formula feeding exclusively is okay. Alternating breastfeeding and alternating formula feeding in the same day is okay. And the digestion is a little different. And so I do talk about the expectations and what to see when a baby has a bowel movement, or how the baby may able to tolerate the mother's diet versus the formula diet. So we go over that in the office. As far as food introduction, the recommendation by the American Academy of Pediatrics is to provide formula or exclusive breastfeeding all the way till age 6 months. Babies thrive, they do very well on simply milk up until that time. And then we recommend introducing solids beginning at 6 months. And solids, when we say solids, we are talking about pureed foods such as starches, rice, baby oatmeal, baby barley, and eventually the various fruits and vegetables. And it's a slow process. We go over the timeline as far as introducing one product at a time as opposed to two, and allowing for reintroduction of different various foods if the baby has rejected them previously. It is a wonderful process. Many parents are anxious to feed their babies solid foods, but we do encourage patience as long as the baby is thriving, as we can see that, breastfeeding and formula feeding all the way up till age 6 months. 6 months thereafter, we come up with a feeding plan that suits the family and the baby after that.